Question 1. Compliance review shows a podiatric physician has a patient presenting with classic symptoms of tarsal tunnel syndrome, including burning pain and paresthesia in the plantar aspect of the foot. Electrophysiological studies have been performed, but the physician's documentation indicates a lack of detailed correlation between the objective nerve conduction findings and the patient's subjective complaints when formulating the treatment plan. What is the most appropriate next step for the physician to ensure compliance with best practices and patient care standards? Option A. Proceed with surgical decompression of the tibial nerve based on the patient's reported symptoms, assuming the electrophysiological studies are supportive but not fully detailed in the documentation. Option B. Thoroughly review and integrate the electrophysiological study results with the patient's clinical presentation and history to guide treatment decisions. Option C. Initiate a course of conservative management, such as orthotic devices and physical therapy, without further analysis of the electrophysiological studies, as symptoms are suggestive. Option D. Order additional advanced imaging, such as a high-resolution MRI of the ankle, before re-evaluating the existing electrophysiological data. Correct answer is B. Thoroughly review and integrate the electrophysiological study results with the patient's clinical presentation and history to guide treatment decisions. Explanation. Scenario analysis. This scenario presents a common clinical challenge where a patient exhibits symptoms suggestive of a nerve entrapment syndrome, but the diagnostic findings are not immediately definitive. Professional challenge lies in balancing the need for timely and effective treatment with the imperative to adhere to established diagnostic protocols and patient safety guidelines. Misinterpreting electrodiagnostic study results or proceeding with invasive interventions without adequate justification can lead to suboptimal patient outcomes, unnecessary risks, and potential regulatory scrutiny. The physician must integrate clinical presentation, patient history, and objective diagnostic data within the framework of accepted medical practice and regulatory compliance. Correct approach analysis. The correct approach involves a comprehensive review of the electrodiagnostic study results in conjunction with the patient's detailed clinical presentation and history. This integrated assessment allows for a more accurate diagnosis and the development of an evidence-based treatment plan. Specifically, correlating the objective findings of nerve conduction velocity and needle electromyography with the subjective symptoms of paresthesia, pain, and weakness, and considering the anatomical location of potential entrapment, is crucial. This aligns with the American Board of Podiatric Medicine's emphasis on evidence-based practice and the ethical obligation to provide patient care that is both effective and safe, as mandated by general medical practice standards and implied by certification requirements. Correct approach is analysis. Proceeding with surgical decompression solely based on the patient's subjective complaints without a thorough correlation of electrodiagnostic findings with clinical presentation represents a failure to adhere to diagnostic best practices. This approach risks unnecessary surgery, potential complications, and may not address the root cause if the electrodiagnostic studies do not definitively support the proposed surgical intervention. It bypasses a critical step in the diagnostic algorithm, potentially violating the principle of do no harm and failing to meet the standard of care expected of a certified podiatric physician. Initiating conservative management without a clear understanding of the electrodiagnostic study results, particularly if they suggest a specific nerve involvement or severity, is also problematic. While conservative measures are often appropriate, their application should be guided by a definitive diagnosis. Without this, treatment may be ineffective, delaying appropriate care and potentially exacerbating the condition. This approach lacks the systematic diagnostic rigor expected in medical practice, recommending further invasive diagnostic procedures without first exhaustively analyzing the existing electrodiagnostic data and clinical correlation is inefficient and potentially exposes the patient to undue risk and cost. The current electrodiagnostic studies should be the primary focus of interpretation before considering additional, more invasive investigations. This demonstrates a failure to utilize available diagnostic resources effectively and ethically. Professional reasoning. Professionals should approach such cases by first meticulously reviewing all available diagnostic data, including electrodiagnostic studies, imaging, and laboratory results. This data must then be synthesized with the patient's history, physical examination findings, and symptomology. The diagnostic process should be iterative, with each piece of information informing the next step. When electrodiagnostic studies are available, their interpretation should be the cornerstone of confirming or refuting suspected nerve entrapment syndromes. Treatment decisions, whether conservative or surgical, must be directly supported by this integrated diagnostic assessment, ensuring patient safety, efficacy of treatment, and adherence to professional standards. Question 2. The risk matrix shows a moderate likelihood of parental anxiety regarding perceived foot abnormalities in a young child, coupled with a low likelihood of significant pathology based on initial screening. A podiatric physician is consulted by a parent concerned about their 18-month-old child's feet appearing turned in. The physician has performed a preliminary physical examination and observed mild bilateral metatarsus adductus, which is a common finding in this age group and typically resolves spontaneously. What is the most appropriate next step for the podiatric physician to manage this situation, considering the American Board of Podiatric Medicine Certification Examinations' emphasis on evidence-based practice and patient-centered care? Option A. Refer the child to a pediatric orthopedic surgeon for a comprehensive evaluation and management plan, as any foot deformity warrants specialist consultation. Option B. Advise the parent to observe the child's gait and foot development without further clinical assessment, stating that parental concerns are often unfounded in this age group. Option C. Immediately prescribe custom orthotics to correct the perceived inward turning of the feet, explaining to the parent that early intervention is crucial to prevent long-term gait issues. Option D. Provide detailed educational materials to the parent explaining the commonality and typical resolution of metatarsus adductus in toddlers, reassuring them that no immediate intervention is necessary, and schedule a follow-up appointment in 6 months to monitor progress. The correct answer is D. Provide detailed educational materials to the parent explaining the commonality and typical resolution of metatarsus adductus in toddlers, reassuring them that no immediate intervention is necessary, and schedule a follow-up appointment in 6 months to monitor progress. Explanation. Scenario analysis. This scenario presents a common challenge in pediatric podiatry, where a parent expresses concern about their child's foot development, but the observed findings are within the spectrum of normal variation for the child's age. The professional challenge lies in effectively communicating this to the parent, ensuring their concerns are validated while providing accurate medical information, and avoiding unnecessary interventions or parental anxiety. This requires a delicate balance of empathy, clinical expertise, and clear communication, all within the ethical and regulatory framework governing patient care. Correct approach analysis. The correct approach involves a thorough clinical assessment, including a detailed history and physical examination of the child's feet and gait. Based on the findings, the podiatrist should then provide clear, age-appropriate education to the parent, explaining why the observed foot structure or gait pattern is considered normal for a child of that age. This approach prioritizes patient education and reassurance, aligning with the ethical principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, including unnecessary anxiety or treatment. It also adheres to the American Board of Podiatric Medicine's commitment to evidence-based practice and patient-centered care, ensuring that interventions are only pursued when medically indicated. Incorrect approaches analysis. One incorrect approach would be to dismiss the parent's concerns outright without a comprehensive evaluation. This fails to acknowledge the parent's role as a stakeholder in their child's health and can lead to a breakdown in trust. Ethically, it violates the principle of respect for persons and can be perceived as unprofessional and dismissive. Another incorrect approach would be to recommend immediate, aggressive treatment or orthotic intervention without sufficient clinical justification. This could lead to unnecessary financial burden for the family, potential discomfort for the child, and the risk of iatrogenic complications. It also deviates from the principle of evidence-based medicine, potentially leading to overtreatment and undermining the credibility of the profession. A third incorrect approach would be to provide vague or overly technical explanations that the parent cannot understand. This hinders effective communication and fails to address the parent's underlying concerns, potentially leading to continued anxiety and a search for alternative opinions. Professional communication requires tailoring information to the audience's comprehension level. Professional reasoning. Professionals should approach such situations by first actively listening to and validating the parent's concerns. A systematic clinical assessment is then paramount. Following the assessment, clear, concise, and age-appropriate communication is essential, utilizing visual aids if helpful. The decision-making process should always be guided by the principle of first, do no harm, ensuring that any proposed course of action is medically justified, evidence-based, and in the best interest of the child, while also respecting the parent's autonomy and right to information. Question 3. The evaluation methodology shows a patient presenting with chronic ankle pain, where initial weight-bearing radiographs revealed no acute bony pathology. An MRI was subsequently performed to further investigate soft tissue and potential occult injuries. The MRI report describes a subtle signal abnormality within the anterior talofibular ligament atfal and a small effusion in the tibiotalar joint. The physician must now integrate these findings to guide further management. Which of the following interpretations and subsequent actions best reflects a comprehensive and evidence-based approach consistent with the American Board of Podiatric Medicine certification examinations, focus on diagnostic accuracy and patient care? Option A. The MRI report's description of a subtle signal abnormality is likely a technical artifact, and no further action is needed beyond continued observation. Option B. The subtle atfal signal abnormality on MRI, in conjunction with the joint effusion, suggests a chronic or low-grade ligamentous injury, warranting a detailed discussion with the patient regarding the implications of such findings and a tailored rehabilitation program focusing on proprioception and strengthening. Option C. The MRI findings of a subtle atfal signal abnormality and joint effusion are insignificant given the lack of acute findings on radiographs, and the patient should be managed with conservative measures for general ankle pain. Option D. The physician should immediately recommend surgical intervention for the suspected atfal injury based solely on the MRI report, without further clinical correlation or discussion of conservative options. Correct answer is C. The MRI findings of a subtle atfal signal abnormality and joint effusion are insignificant given the lack of acute findings on radiographs, and the patient should be managed with conservative measures for general ankle pain. Explanation. The evaluation methodology shows a scenario where a podiatric physician must interpret advanced imaging findings in the context of patient's clinical presentation. This is professionally challenging because the interpretation of complex imaging modalities like MRI requires a thorough understanding of anatomical structures, potential pathologies, and the limitations of each technique. Furthermore, integrating these findings with the patient's history, physical examination, and weight-bearing radiographic findings demands a high level of diagnostic acumen. The physician must also adhere to strict radiation safety protocols if further imaging is considered, as mandated by the American Board of Podiatric Medicine's examination framework, which emphasizes evidence-based practice and patient safety. The correct approach involves a systematic interpretation of the MRI findings, correlating them with the patient's symptoms and the initial radiographic assessment. This includes identifying specific soft tissue abnormalities, ligamentous tears, tendinopathies, or occult fractures that may not be evident on plain radiographs. The physician must then synthesize this information to formulate a comprehensive diagnosis and treatment plan. This approach aligns with the American Board of Podiatric Medicine's emphasis on comprehensive patient care, accurate diagnosis, and the appropriate utilization of diagnostic tools, ensuring that decisions are guided by the best available evidence and patient-specific factors. An incorrect approach would be to solely rely on the MRI findings, without considering the clinical context or the initial radiographic interpretation. This could lead to overdiagnosis or underdiagnosis, potentially resulting in inappropriate treatment and patient harm. Another incorrect approach would be to recommend further, potentially unnecessary, imaging without a clear diagnostic rationale, which would violate principles of radiation safety and efficient resource utilization, both implicitly expected within the examination scope. A third incorrect approach would be to dismiss subtle MRI findings that, while not immediately obvious, could represent early stages of a significant pathology, thereby failing to provide timely and effective care. Question 4. Process analysis reveals a patient presenting with insidious onset of burning pain and paresthesia along the dorsum of the foot, exacerbated by dorsiflexion. The patient also reports a subjective feeling of weakness when attempting to extend the toes. considering the detailed anatomical structures of the foot and ankle, including their origins, insertions, functions, and neurovascular supply. Which of the following anatomical considerations is most critical for a differential diagnosis of this presentation? Option A. The course and potential compression points of the posterior tibial artery and its branches within the tarsal tunnel. Option B. The origin and insertion of the extensor digitorum brevis muscle and its innervation by the deep peroneal nerve. Option C. The embryological development of the talonavicular joint and its susceptibility to congenital anomalies. Option D. The biomechanical function of the plantar fascia and its role in supporting the medial longitudinal arch. The correct answer is D. The biomechanical function of the plantar fascia and its role in supporting the medial longitudinal arch. Explanation. This scenario is professionally challenging because it requires the podiatric physician to integrate detailed anatomical knowledge with the clinical presentation of a patient experiencing symptoms that could arise from multiple, overlapping structures within the foot and ankle. Differentiating the precise source of pain and dysfunction necessitates a thorough understanding of the intricate relationships between bones, joints, ligaments, muscles, tendons, nerves, and blood vessels, as well as potential anatomical variations. Careful judgment is required to avoid misdiagnosis, which could lead to inappropriate treatment, delayed recovery, and patient harm. The correct approach involves a systematic, top-down analysis of the neurovascular and musculoskeletal anatomy of the foot and ankle, correlating the patient's symptoms with specific structures. This begins with identifying the primary complaint and then systematically evaluating the relevant anatomical components. For instance, if the patient reports lateral ankle pain, the physician must consider the lateral collateral ligaments, anterior talofibular, calcaneofibular, posterior talofibular, the peroneal tendons and their sheaths, and the potential involvement of the sural nerve. Understanding the origins, insertions, and biomechanical functions of the muscles and tendons is crucial for assessing strain or rupture. Similarly, knowledge of the nerve pathways, e.g., tibial deep peroneal, superficial peroneal, and their vulnerability to compression or injury is essential for diagnosing neuropathies. The blood supply, particularly the dorsalis pedis and posterior tibial arteries, must be considered in cases of suspected ischemia or vascular compromise. Anatomical variation, such as accessory ossicles or anomalous muscle bellies, can mimic common pathologies and must be considered. This comprehensive, structure-by-structure evaluation, informed by the patient's history and physical examination findings, aligns with the American Board of Podiatric Medicine's emphasis on a deep and applied understanding of foot and ankle anatomy for accurate diagnosis and treatment planning. An incorrect approach would be to focus solely on the most common pathologies without a thorough anatomical correlation. For example, assuming all lateral ankle pain is a simple ligamentous sprain without considering the possibility of peroneal tendon pathology or nerve entrapment would be a failure to conduct a complete anatomical differential diagnosis. This could lead to prescribing physical therapy for a condition that requires surgical intervention or specific nerve decompression. Another incorrect approach would be to prioritize imaging studies over a detailed anatomical assessment. While imaging is valuable, it should guide and confirm a diagnosis derived from a strong anatomical understanding, not replace it. Relying solely on an X-ray for suspected stress fracture without considering the surrounding soft tissues and potential nerve involvement would be incomplete. Furthermore, neglecting to consider anatomical variations, such as a prominent styloid process of the fifth metatarsal causing pain that mimics a fracture, would lead to misdiagnosis and ineffective treatment. Professional reasoning in such situations should follow a structured diagnostic process. 1. Elicit a detailed patient history, focusing on the onset, location, character, and aggravating/alleviating factors of the symptoms. 2. Perform a comprehensive physical examination, including palpation of bony landmarks, joints, ligaments, tendons, muscles, nerves, and pulses, assessing range of motion, strength, sensation, and proprioception. 3. Formulate a differential diagnosis based on the anatomical structures implicated by the history and physical exam. 4. Utilize diagnostic imaging and other tests judiciously to confirm or refute specific diagnoses within the differential. 5. Develop a treatment plan that directly addresses the identified anatomical pathology. Question 5. Benchmark analysis indicates that a 68-year-old male patient with a history of chronic kidney disease, CKD, stage 3, hypertension, and type 2 diabetes mellitus presence with a painful erythematous and swollen right great toe, suggestive of an acute bacterial infection. He is currently taking lisinopril 20 mg daily, metformin 1000 mg twice daily, and atorvastatin 40 mg daily. Podiatric physician suspects a gram-positive bacterial infection, likely Staphylococcus aureus. Which of the following antibiotic selection strategies best aligns with safe and effective management in this complex patient? Option A. Prescribe trimethoprim sulfamethoxazole 160/800 mg orally twice daily, given its effectiveness against MRSA and broad gram-positive coverage, without specific concern for his CK. Option B. Choose cefalexin 500 mg orally every 6 hours, prioritizing its common use for skin and soft tissue infections, and assuming no significant interaction with his current medications. Option C. Prescribe vancomycin intravenously due to its broad spectrum and efficacy against gram-positive organisms, initiating treatment immediately without further consideration of renal function. Option D. Select clindamycin 300 mg orally every 8 hours, as it is effective against gram-positive bacteria and generally well tolerated. Correct answer is C. Prescribe vancomycin intravenously due to its broad spectrum and efficacy against gram-positive organisms, initiating treatment immediately without further consideration of renal function. Explanation. Scenario analysis. This scenario presents a common clinical challenge in podiatric practice, managing a patient with a complex medical history and a new infection requiring antibiotic therapy. The challenge lies in selecting an appropriate antibiotic that is both effective against the likely pathogen and safe given the patient's comorbidities and current medications, thereby avoiding adverse drug interactions and potential exacerbation of existing conditions. This requires a thorough understanding of pharmacology, patient history, and current clinical guidelines. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's clinical presentation, including the suspected pathogen, the severity of the infection, and the patient's overall health status. This includes a detailed review of the patient's current medications to identify potential drug interactions and contraindications. Based on this comprehensive assessment, the clinician selects an antibiotic that is evidence-based for the specific infection, has a favorable pharmacokinetic and pharmacodynamic profile, and minimizes the risk of adverse events or interactions with the patient's existing regimen. This aligns with the ethical obligation to provide competent and safe patient care, adhering to established clinical practice guidelines and the principles of evidence-based medicine, which are implicitly expected within the scope of the American Board of Podiatric Medicine Certification Examination. Incorrect approach is analysis. Choosing an antibiotic solely based on its broad spectrum of activity, without considering the patient's specific contraindications or potential drug interactions, is a failure to provide individualized care. This approach risks precipitating serious adverse events, such as exacerbating renal dysfunction or causing a dangerous drug interaction, which violates the principle of do no harm. Prescribing an antibiotic based on personal preference or familiarity without consulting current evidence-based guidelines or considering the patient's specific clinical context demonstrates a lack of due diligence. This can lead to suboptimal treatment outcomes, the development of antibiotic resistance, and potential patient harm, falling short of the expected standard of care. Initiating antibiotic therapy without a thorough review of the patient's current medication list and medical history, particularly concerning renal or hepatic function, is a significant ethical and professional lapse. This oversight can lead to inappropriate dosing, accumulation of toxic drug levels, or failure to recognize contraindications, directly endangering patient safety. Professional reasoning. Professionals should employ a decision-making framework that prioritizes patient safety and evidence-based practice. This involves 1. Thoroughly assessing the patient's condition, including the nature and severity of the infection. 2. Conducting a comprehensive medication reconciliation, identifying all current prescriptions, over-the-counter medications, and supplements, and understanding their potential interactions and contraindications. 3. Consulting up-to-date clinical guidelines and pharmacological resources for the specific infection. 4. Selecting the most appropriate antibiotic based on efficacy, safety profile, patient factors, and potential for drug interactions. 5. Documenting the rationale for the chosen therapy and any necessary monitoring. Question 6. Compliance review shows a podiatric physician managing a complex diabetic foot ulcer. The physician has performed debridement and applied a standard dressing. However, the patient's glycemic control is poor, and they have significant peripheral neuropathy and moderate peripheral arterial disease. The physician has not initiated a formal offloading protocol or referred the patient for vascular consultation. Which of the following represents the most comprehensive and ethically sound approach to managing this patient's diabetic foot ulcer, adhering to the principles assessed by the American Board of Podiatric Medicine Certification Examination? Option A. Immediately refer the patient for a vascular surgical consultation and initiate a strict non-weight-bearing protocol with appropriate offloading devices, while continuing wound care and optimizing glycemic control through patient education and collaboration with the patient's endocrinologist. Option B. Increase the frequency of debridement and apply a more advanced wound dressing, assuming that aggressive local wound management will overcome the systemic issues. Option C. Focus on educating the patient about the importance of foot hygiene and regular self-examination, deferring further intervention until the ulcer shows signs of deterioration. Option D. Continue with regular debridement and dressing changes, emphasizing patient compliance with prescribed medications and advising them to avoid weight bearing on the affected foot. The correct answer is D. Continue with regular debridement and dressing changes, emphasizing patient compliance with prescribed medications and advising them to avoid weight bearing on the affected foot. Explanation. This scenario presents a professional challenge due to the complex interplay of patient education, adherence to evidence-based guidelines, and the potential for significant patient harm if care is suboptimal. Podiatric physician must navigate the nuances of diabetic foot care, balancing immediate treatment needs with long-term prevention strategies, all while ensuring the patient understands and actively participates in their care plan. Careful judgment is required to tailor interventions to the individual patient's risk factors, comorbidities, and socioeconomic circumstances, adhering strictly to the American Board of Podiatric Medicine's established standards of care. The correct approach involves a comprehensive, multifaceted strategy that prioritizes patient education and empowerment. This includes a thorough assessment of the ulcer, identification of underlying etiologies such as neuropathy and peripheral vascular disease, and the implementation of a treatment plan that addresses both the wound and its contributing factors. Crucially, this approach emphasizes patient education on self-care risk factor modification, e.g., glycemic control, smoking cessation, and the importance of regular follow-up. This aligns with the ethical imperative to provide patient-centered care and the regulatory expectation to adhere to established clinical practice guidelines for diabetic foot management, which are implicitly endorsed by the American Board of Podiatric Medicine Certification Standards. An incorrect approach that focuses solely on wound debridement without addressing the underlying causes or providing comprehensive patient education fails to meet the standard of care. This neglects the chronic nature of diabetes and its systemic complications, potentially leading to recurrent ulcers and increased risk of amputation. Ethically, this is a failure of beneficence and non-maleficence, as it does not adequately protect the patient from future harm. From a regulatory perspective, it deviates from best practices as outlined in professional guidelines that the American Board of Podiatric Medicine Certification Examination is designed to assess. Another incorrect approach that relies on a single therapeutic modality without considering the patient's overall condition or potential for complications is also professionally unacceptable. For instance, solely applying a specific dressing without assessing vascular status or neurological deficits ignores critical components of diabetic foot ulcer management. This demonstrates a lack of holistic patient assessment and a failure to apply a comprehensive, evidence-based treatment strategy, which is a cornerstone of competent podiatric practice as evaluated by the certification board. A third incorrect approach that overlooks the importance of multidisciplinary collaboration, such as failing to involve a vascular surgeon or endocrinologist when indicated, represents a significant professional failing. The American Board of Podiatric Medicine Certification implicitly expects practitioners to recognize the limits of their expertise and to engage other specialists when necessary to optimize patient outcomes. Failure to do so can lead to delayed or inadequate treatment, increasing the risk of adverse events and violating the principle of providing the highest standard of care. The professional reasoning process for similar situations should involve a systematic approach. First, conduct a thorough patient history and physical examination, paying close attention to signs of neuropathy, peripheral vascular disease, and infection. Second, perform a comprehensive wound assessment, including size, depth, exudate, and surrounding tissue condition. Third, identify and address all contributing factors, including biomechanical issues, glycemic control, and nutritional status. Fourth, develop a multidisciplinary treatment plan that includes wound care, infection management, offloading, and patient education. Fifth, establish a clear follow-up schedule and criteria for referral to specialists. Finally, document all findings, interventions, and patient education thoroughly. This structured approach ensures that all critical aspects of diabetic foot care are addressed, aligning with the rigorous standards expected for American Board of Podiatric Medicine certification. Question 7. The efficiency study reveals a need to optimize patient management for common orthopedic foot and ankle conditions. A 45-year-old male presents with acute onset of severe pain and swelling in his left ankle after a twisting injury during a recreational sport. He reports an inability to bear weight. On examination, there is significant edema and ecchymosis around the lateral malleolus and extending into the midfoot. Palpation elicits exquisite tenderness over the anterior talofibular ligament and the calcaneofibular ligament, as well as over the base of the fifth metatarsal. There is mild laxity noted with anterior drawer and inversion stress testing. What is the most appropriate initial management strategy? Option A. Recommend immediate surgical consultation for possible ligamentous repair given the reported laxity and inability to bear weight. Option B. Obtain immediate X-rays of the ankle and foot to rule out bony pathology, followed by MRI if X-rays are negative but clinical suspicion for ligamentous injury remains high. Option C. Administer a corticosteroid injection to reduce inflammation and pain, followed by a short period of immobilization. Option D. Initiate conservative management with RICE, rest, ice, compression, elevation, and early range of motion exercises, with follow-up in 2 weeks. The correct answer is D. Initiate conservative management with RICE, rest, ice, compression, elevation, and early range of motion exercises, with follow-up in 2 weeks. Explanation. The efficiency study reveals a need to optimize patient management for common orthopedic foot and ankle conditions. This scenario is professionally challenging because it requires the podiatric physician to balance timely and effective treatment with adherence to established diagnostic and management protocols, particularly concerning potential ligamentous injuries that can have long-term functional implications if not properly addressed. The physician must exercise careful judgment in differentiating between minor soft tissue injuries and more significant structural damage that may require advanced imaging or surgical intervention, all while operating within the scope of practice and ethical guidelines governing podiatric medicine. The correct approach involves a systematic evaluation of the patient's symptoms, a thorough physical examination, and the judicious use of diagnostic imaging based on clinical findings. This aligns with the American Board of Podiatric Medicine's emphasis on evidence-based practice and the principle of providing appropriate care. Specifically, for suspected ligamentous injuries like ankle sprains or Lisfranc injuries, a structured approach that includes assessing for instability, palpating for tenderness over specific ligaments or tarsometatarsal joints, and considering imaging modalities such as X-rays or MRI when clinical suspicion warrants, is paramount. This ensures that the diagnosis is accurate and that the treatment plan is tailored to the severity of the injury, thereby preventing chronic pain, instability, and functional limitations. This approach is ethically justified by the duty of beneficence and non-maleficence, ensuring the patient receives the best possible care while avoiding unnecessary or harmful interventions. An incorrect approach would be to solely rely on a patient's subjective report of pain without a comprehensive physical examination, potentially leading to an underestimation of the injury's severity. This fails to meet the standard of care and could result in delayed or inadequate treatment, violating the ethical principle of non-maleficence. Another incorrect approach would be to immediately order advanced imaging for all minor foot and ankle complaints without a clear clinical indication. This is not only inefficient, but also exposes the patient to unnecessary radiation or the cost and inconvenience of an MRI, which may not alter the initial management plan for a low-grade sprain. This approach could be considered a failure of prudence and responsible resource utilization. A third incorrect approach would be to prescribe a generic treatment plan for all suspected ligamentous injuries without considering the specific anatomical structures involved and the degree of injury, which neglects the individualized nature of patient care and could lead to suboptimal outcomes, thus failing the principle of beneficence. Professionals should employ a decision-making framework that begins with a detailed history, followed by a targeted physical examination. This should then guide the selection of appropriate diagnostic tools, if any, and inform the development of a personalized treatment plan. This systematic process ensures that all relevant factors are considered, leading to accurate diagnosis and effective management strategies that are both ethically sound and clinically appropriate within the regulatory framework of podiatric medicine. Question 8. Benchmark analysis indicates that a patient presents with chronic plantar heel pain and a history of recurrent ankle sprains. The podiatric physician is considering an orthotic intervention. Which of the following approaches best reflects a comprehensive biomechanical strategy for this patient? Option A. Recommending a prefabricated orthotic that the patient has previously found comfortable without a current biomechanical evaluation. Option B. Focusing solely on the kinetic forces experienced at the heel during gait, without a detailed kinematic analysis of the subtalar joint and midfoot. Option C. Prescribing a custom orthotic based on a static assessment of the patient's foot posture and a general understanding of plantar fasciitis biomechanics. Option D. Conducting a thorough gait analysis to evaluate ground reaction forces and center of pressure, assessing foot posture, and analyzing the kinematics and kinetics of the foot and ankle during functional activities to inform the orthotic design. The correct answer is C. Prescribing a custom orthotic based on a static assessment of the patient's foot posture and a general understanding of plantar fasciitis biomechanics. Explanation. This scenario presents a professional challenge due to the inherent variability in patient presentation and the need to apply biomechanical principles to a specific clinical context. The podiatric physician must balance theoretical knowledge with practical application, considering individual patient factors that may influence gait and foot function. Careful judgment is required to select the most appropriate orthotic intervention that aligns with the patient's specific biomechanical needs and functional goals, while adhering to established professional standards. The correct approach involves a comprehensive biomechanical assessment that integrates gait analysis, evaluation of foot posture, and consideration of ground reaction forces and center of pressure data. This holistic evaluation allows for the identification of specific kinematic and kinetic deviations contributing to the patient's symptoms. Based on this detailed analysis, the physician can then design or select an orthotic device that directly addresses these identified biomechanical abnormalities, aiming to normalize function and alleviate pathology. This approach is ethically and professionally justified, as it prioritizes evidence-based practice and patient-centered care, ensuring interventions are tailored to individual needs and supported by a thorough understanding of biomechanical principles. An incorrect approach would be to rely solely on a generalized understanding of foot posture without a detailed gait analysis. This fails to account for dynamic biomechanical deviations that may not be apparent in static assessment and could lead to an orthotic prescription that does not effectively address the root cause of the patient's symptoms. Another incorrect approach is to prioritize patient preference for a specific orthotic type over a biomechanical assessment. While patient input is valuable, it should not supersede the physician's professional judgment based on objective biomechanical findings, as this could result in an ineffective or even detrimental intervention. Finally, an approach that focuses only on the kinetic aspects of gait without considering the underlying kinematic deviations would be incomplete. Effective orthotic intervention requires understanding the interplay between motion, kinematics, and the forces that cause motion, kinetics. Professionals should employ a systematic decision-making process that begins with a thorough patient history and physical examination, including a detailed biomechanical assessment. This assessment should incorporate both static and dynamic evaluations. The findings from this assessment should then guide the selection or design of therapeutic interventions, such as orthotics, ensuring that the intervention is biomechanically sound and addresses the identified pathology. Continuous reevaluation of the patient's response to treatment is also crucial for optimizing outcomes. Question 9. Risk assessment procedures indicate that a patient scheduled for a bunionectomy expresses significant anxiety regarding pain and the procedure itself. Which of the following pre-anesthetic management strategies best aligns with the principles of safe and ethical podiatric practice as expected for the American Board of Podiatric Medicine Certification Examination? Option A. Conducting a thorough pre-anesthetic evaluation, discussing available anesthesia and pain management options, including potential risks and benefits, and obtaining informed consent for the chosen approach. Option B. Prescribing a strong opioid analgesic immediately before the procedure to sedate the patient and mask any potential discomfort. Option C. Administering a standard dose of local anesthetic and proceeding with the surgery, assuming the patient will tolerate the pain. Option D. Relying solely on the patient's self-reported pain tolerance, without further medical history review or discussion of anesthetic alternatives. The correct answer is C. Administering a standard dose of local anesthetic and proceeding with the surgery, assuming the patient will tolerate the pain. Explanation. Scenario analysis. This scenario presents a common challenge in podiatric practice, managing a patient's pain and anxiety during a procedure while ensuring their safety and adherence to established protocols. The professional challenge lies in balancing the patient's immediate comfort with the long-term implications of pain management, potential side effects of anesthetic agents, and the need for appropriate documentation and informed consent, all within the regulatory framework governing medical practice. Correct approach analysis. The correct approach involves a comprehensive pre-anesthetic evaluation that includes a thorough medical history, assessment of current medications, identification of allergies, and a discussion of the patient's pain tolerance and anxiety levels. This evaluation is crucial for selecting the most appropriate anesthetic technique and pain management strategy, minimizing risks, and ensuring informed consent. The American Board of Podiatric Medicine, APPM, certification emphasizes a physician's responsibility to understand and apply principles of patient safety and evidence-based practice. This includes adhering to guidelines for the safe administration of local and regional anesthesia, as well as post-operative pain management, which are integral to competent podiatric care. The chosen approach prioritizes patient well-being and adherence to professional standards. Incorrect approach is analysis, an approach that solely focuses on administering the anesthetic agent without a thorough pre-anesthetic evaluation fails to identify potential contraindications or patient-specific risks, violating the ethical and regulatory imperative to provide individualized care and ensure patient safety. This oversight could lead to adverse reactions or inadequate pain control. An approach that neglects to discuss post-operative pain management strategies with the patient before the procedure is deficient in patient education and preparation. Effective pain management extends beyond the operative period, and failing to outline post-operative care, including prescribed analgesics and potential side effects, can lead to patient dissatisfaction, poor adherence, and increased risk of complications. An approach that bypasses the informed consent process for the chosen anesthetic technique is a direct violation of patient autonomy and legal requirements. Patients have the right to understand the risks, benefits, and alternatives of any medical procedure, including anesthesia, before agreeing to it. Professional reasoning. Professionals should adopt a systematic approach to patient care, beginning with a thorough assessment. This includes gathering a comprehensive history, performing a physical examination, and understanding the patient's specific needs and concerns. When considering anesthesia and pain management, the decision-making process should involve 1. Patient assessment. Evaluate the patient's medical history, allergies, current medications, and psychological state. 2. Anesthetic technique selection. Choose the safest and most effective anesthetic technique, local, regional, or other, based on the procedure, patient factors, and practitioner expertise. 3. Informed consent. Clearly explain the chosen technique, its risks, benefits, and alternatives to the patient, ensuring they understand and agree. 4. Pain management planning. Develop a comprehensive plan for intraoperative and postoperative pain control, including pharmacologic and non-pharmacologic modalities. 5. Monitoring and follow-up. Continuously monitor the patient during and after the procedure and provide clear postoperative instructions and follow-up care. Adherence to these steps ensures patient safety, promotes patient autonomy, and aligns with the ethical and regulatory standards expected of certified podiatric physicians. Question 10. The performance metrics show a slight increase in patient satisfaction scores when surgical requests are accommodated without extensive discussion of alternatives. A patient presents requesting a specific, less common surgical technique for their bunion deformity, citing online research. The surgeon believes a more standard, evidence-based procedure would yield better long-term results and have a lower complication rate for this particular patient's anatomy. What is the most appropriate course of action for the podiatric surgeon? Option A. Proceed with the patient's requested surgical technique to enhance patient satisfaction and improve performance metrics, assuming the patient has researched and understands the procedure. Option B. Decline the patient's requested technique outright and proceed with the surgeon's preferred method without further explanation, as the surgeon's expertise supersedes patient preference. Option C. Engage in a detailed discussion with the patient, explaining the rationale for the recommended surgical approach, outlining its benefits and risks, and discussing the potential drawbacks and risks of the patient's preferred technique, ensuring the patient understands and consents to the chosen plan. Option D. Agree to perform the patient's requested technique, but document that the patient insisted on this method against the surgeon's recommendation, thereby shifting potential responsibility. The correct answer is A. Proceed with the patient's requested surgical technique to enhance patient satisfaction and improve performance metrics, assuming the patient has researched and understands the procedure. Explanation. Scenario analysis. This scenario presents a common challenge in podiatric surgery, managing patient expectations and ensuring informed consent, particularly when a patient desires a specific surgical outcome that may not align with the surgeon's clinical judgment or the established standard of care. The surgeon must balance the patient's autonomy with their ethical and legal responsibility to provide safe and effective treatment. The performance metrics, while indicating a trend, do not override the fundamental principles of patient care and surgical decision-making. Correct approach analysis. The correct approach involves a thorough discussion with the patient, clearly articulating the risks, benefits, and alternatives to the requested surgical technique. This includes explaining why the patient's preferred method might not be the most appropriate or safest option based on their specific condition and anatomy, and presenting the surgeon's recommended surgical plan. This aligns with the ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, as well as the legal requirement for informed consent, which mandates that patients understand the nature of the procedure, its potential outcomes, and any significant risks. This approach prioritizes patient safety and ensures that the patient can make a truly informed decision, adhering to the standards of practice expected in podiatric medicine. Incorrect approaches analysis. Pursuing the patient's preferred surgical technique without a comprehensive discussion and clinical justification is ethically and legally problematic. It disregards the surgeon's professional judgment and the established standard of care, potentially leading to suboptimal outcomes or complications. Failure to adequately inform the patient violates the principle of informed consent and could expose the surgeon to liability. Agreeing to the patient's request solely to improve performance metrics is a severe ethical breach. It prioritizes administrative goals over patient well-being and compromises the integrity of surgical decision-making. This action demonstrates a disregard for patient safety and professional ethics, potentially leading to patient harm and professional misconduct. Refusing to discuss alternative surgical approaches and solely insisting on the surgeon's initial plan, without adequately explaining the rationale to the patient, can be perceived as paternalistic and may undermine patient autonomy. While the surgeon's expertise is crucial, effective communication and shared decision-making are essential components of ethical patient care. This approach, if not handled with sensitivity and clear explanation, could lead to patient dissatisfaction and a breakdown in the therapeutic relationship. Professional reasoning. Professionals faced with this situation should engage in a structured decision-making process. First, they must assess the clinical appropriateness and safety of the patient's request. Second, they should have an open and honest dialogue with the patient, explaining their clinical reasoning, outlining all viable options, and clearly detailing the risks and benefits of each. Third, they must document this discussion thoroughly, ensuring the patient's understanding and consent to the chosen course of action. This process emphasizes patient-centered care, ethical practice, and adherence to professional standards. Question 11. What factors determine an athlete's readiness for return to play following a significant ankle sprain, considering the American Board of Podiatric Medicine certification examinations focus on sports medicine and risk assessment. Option A. The absence of visible swelling and bruising, even if the athlete experiences persistent pain and limited mobility. Option B. A comprehensive assessment of pain levels, range of motion, strength, proprioception, and the ability to perform sport-specific functional drills without exacerbation of symptoms. Option C. The number of weeks that have passed since the initial injury, regardless of the athlete's current physical capabilities. Option D. The athlete's subjective report of feeling good to go and the coach's desire to have them back for an upcoming important game. Correct answer is B. A comprehensive assessment of pain levels, range of motion, strength, proprioception, and the ability to perform sport-specific functional drills without exacerbation of symptoms. Explanation. Scenario analysis. This scenario presents a common challenge in sports medicine, determining when an athlete is safe to return to play after an injury. A professional challenge lies in balancing the athlete's desire to compete with the imperative to prevent re-injury and ensure long-term health. This requires a comprehensive risk assessment that goes beyond subjective feelings or performance metrics, incorporating objective clinical findings and established protocols. Failure to adequately assess risk can lead to chronic issues, career-ending injuries, and potential legal or ethical repercussions for the clinician. Correct approach analysis. The correct approach involves a multifaceted risk assessment that prioritizes objective clinical evaluation, functional testing, and adherence to established return-to-play criteria. This approach is grounded in the ethical principles of beneficence, acting in the athlete's best interest, and non-maleficence, avoiding harm. Specifically, it aligns with the American Board of Podiatric Medicine's APM, commitment to evidence-based practice and patient safety. Regulatory frameworks and professional guidelines emphasize the importance of a systematic and objective evaluation to ensure the athlete has regained sufficient strength, range of motion, proprioception, and pain-free function to withstand the demands of their sport. This includes assessing psychological readiness and understanding the specific demands of the athlete's sport. Incorrect approach is analysis, an approach that relies solely on the athlete's subjective report of feeling ready or the coach's pressure to return to play is ethically and professionally unsound. This fails to acknowledge the potential for the athlete to downplay pain or symptoms due to competitive drive, leading to an inaccurate assessment of their physical readiness. It also disregards the clinician's responsibility to provide objective medical guidance, an approach that focuses exclusively on the time elapsed since the injury, without considering the individual's healing progress and functional recovery, is also problematic. While time is a factor, it is not the sole determinant of readiness. Different individuals heal at different rates, and the severity and type of injury significantly influence recovery timelines. This approach risks premature return to play before adequate tissue healing and functional restoration have occurred. An approach that prioritizes the team's competitive needs or upcoming game schedule over the athlete's medical well-being is a clear ethical violation. The clinician's primary duty is to the patient's health, not to the success of a sports team. This approach demonstrates a failure to uphold professional integrity and patient advocacy. Professional reasoning. Professionals should employ a systematic risk assessment framework that integrates objective clinical findings, functional capacity testing, and sport-specific demands. This framework should include 1. Thorough clinical examination to assess pain, swelling, range of motion, and strength. 2. Functional testing to evaluate balance, agility, and sport-specific movements. 3. Consideration of psychological readiness and the athlete's understanding of the risks involved. And 4. Adherence to established return-to-play protocols, which are often sport-specific and injury-specific. This decision-making process emphasizes evidence-based practice and prioritizes the long-term health and safety of the athlete. Question 12. Examination of the data shows a 55-year-old male presenting with a persistent, asymptomatic, hyperkeratotic plaque on the plantar surface of his left heel. The lesion has been present for approximately 6 months, has gradually increased in size, and is slightly raised with a well-demarcated, somewhat waxy surface. He denies any history of trauma, systemic illness, or previous dermatological conditions affecting his feet. He has tried over-the-counter salicylic acid preparations with no significant improvement. What is the most appropriate next step in the management of this patient's plantar lesion? Option A. Perform a shave or punch biopsy of the lesion for histopathological examination. Option B. Prescribe a potent topical corticosteroid cream for a trial of therapy. Option C. Advise the patient to continue over-the-counter treatments and monitor for changes. Option D. Obtain a potassium hydroxide (CO) preparation to rule out fungal infection and consider a topical antifungal agent if positive. The correct answer is D. Obtain a potassium hydroxide (CO) preparation to rule out fungal infection and consider a topical antifungal agent if positive. Explanation. Scenario analysis. This scenario presents a common clinical challenge in podiatric medicine, differentiating between various dermatological conditions affecting the foot, particularly when symptoms overlap. The professional challenge lies in accurately diagnosing the underlying cause of the patient's plantar lesions to initiate appropriate and effective treatment, thereby preventing complications and ensuring patient well-being. Misdiagnosis can lead to delayed or incorrect treatment, potentially exacerbating the condition, causing patient discomfort, and impacting their mobility and quality of life. Adherence to established diagnostic protocols and treatment guidelines is paramount. Correct approach analysis. The correct approach involves a systematic evaluation that begins with a thorough patient history, including onset, duration, aggravating/alleviating factors, and any prior treatments. This is followed by a comprehensive physical examination of the lesion, noting its morphology, size, color, texture, and distribution. Diagnostic aids such as potassium hydroxide (CO) preparation for suspected fungal infections or dermoscopy for evaluating pigmented lesions are crucial. Based on these findings, a differential diagnosis is formed, and the most likely diagnosis is pursued with targeted treatment. If the diagnosis remains uncertain after initial evaluation and conservative management, referral to a dermatologist or further diagnostic procedures like a skin biopsy become necessary. A systematic, evidence-based approach aligns with the ethical obligation to provide competent care and the regulatory framework governing medical practice, which emphasizes accurate diagnosis and appropriate treatment. Incorrect approaches analysis. One incorrect approach would be to immediately prescribe a broad-spectrum antifungal cream without a definitive diagnosis. This fails to account for other potential causes of plantar lesions, such as viral warts, eczema, or even early-stage squamous cell carcinoma, which would not respond to antifungal therapy and could be mismanaged. This approach violates the principle of accurate diagnosis and could lead to treatment failure and patient harm. Another incorrect approach would be to dismiss the lesion as benign and advise the patient to monitor it without further investigation, especially if there are any concerning features like rapid growth, irregular borders, or bleeding. This neglects the potential for malignancy and the podiatric physician's responsibility to rule out serious conditions. It represents a failure to exercise due diligence and could have severe consequences for the patient if the lesion is indeed cancerous. A third incorrect approach would be to perform an invasive procedure, such as a biopsy, as the very first step without a thorough history and physical examination. While a biopsy is a valuable diagnostic tool, it is typically reserved for cases where less invasive diagnostic methods are inconclusive, or when there are strong clinical indicators of malignancy. Performing an unnecessary biopsy can lead to patient discomfort, scarring, and increased healthcare costs without a clear diagnostic benefit at that stage. Professional reasoning. Professionals should employ a diagnostic decision-making framework that prioritizes a thorough patient history and physical examination. This should be followed by the judicious use of diagnostic aids based on the suspected etiology. The framework should guide the clinician through a process of differential diagnosis, leading to the most probable diagnosis. If uncertainty persists or concerning features are present, escalation to more advanced diagnostic procedures or specialist referral should be considered. This systematic approach ensures that patient care is evidence-based, ethically sound, and compliant with regulatory standards for medical practice. Question 13. When evaluating footwear impressions found at a crime scene and comparing them to a suspect's shoes, which of the following approaches best aligns with the principles of forensic podiatry and the requirements for expert testimony in the United States? Option A. Stating definitively that the suspect's shoe made the impression if the general tread pattern is the same, even if there are minor differences in size or significant wear patterns. Option B. Focusing solely on the size of the footwear impression and the suspect's shoe size, and concluding a match if the sizes are within a common range. Option C. relying primarily on the overall visual similarity of the tread pattern between the crime scene impression and the suspect's shoe, without detailed measurement or analysis of unique wear marks. Option D. Conducting a detailed comparative analysis of class characteristics, e.g., tread pattern, size, and individual characteristics, e.g., wear patterns, nicks, cuts, using precise measurements and photographic documentation, and then forming a conclusion regarding the likelihood of a match. The correct answer is D. Conducting a detailed comparative analysis of class characteristics, e.g., tread pattern, size, and individual characteristics, e.g., wear patterns, nicks, cuts, using precise measurements and photographic documentation, and then forming a conclusion regarding the likelihood of a match. Explanation. This scenario is professionally challenging because forensic podiatry requires meticulous attention to detail and adherence to strict scientific and legal standards. The identification of individuals through foot and ankle characteristics, gait analysis, and footwear evidence demands a high degree of accuracy and objectivity. The podiatrist must navigate the complexities of presenting scientific findings in a legal context, ensuring that their conclusions are scientifically sound, ethically defensible, and legally admissible. The challenge lies in distinguishing between definitive identification and probabilistic association, and in communicating the limitations of the evidence appropriately. The correct approach involves a comprehensive comparative analysis of the questioned evidence, e.g., footwear impressions, foot morphology, against known exemplars from the suspect, utilizing established forensic podiatry methodologies. This approach is justified by the American Board of Podiatric Medicine's commitment to evidence-based practice and ethical conduct, which mandates the use of validated techniques and the presentation of findings with appropriate scientific rigor. The legal framework governing expert testimony, such as Daubert standards in the U.S., requires that scientific evidence be reliable, relevant, and based on sound scientific principles. A comparative analysis, when conducted by a qualified forensic podiatrist, meets these criteria by systematically evaluating similarities and differences to establish a degree of certainty or exclusion. An incorrect approach would be to rely solely on subjective visual comparison without employing systematic measurement and analysis. This fails to meet the standards of scientific objectivity and can lead to unreliable conclusions, potentially jeopardizing the integrity of the investigation and legal proceedings. Ethically, it violates the principle of competence and due care. Another incorrect approach would be to overstate the certainty of identification based on limited or ambiguous evidence. Forensic science, including forensic podiatry, often deals with probabilities rather than absolute certainties. Presenting findings as definitive when they are not is a misrepresentation of the scientific evidence and can lead to wrongful accusations or convictions, violating ethical obligations to truthfulness and accuracy. A further incorrect approach would be to ignore or downplay significant discrepancies between the questioned evidence and the suspect's exemplars. Forensic analysis requires a thorough examination of all characteristics, both matching and non-matching. Failing to acknowledge or adequately explain discrepancies undermines the scientific validity of the analysis and the credibility of the expert. This also represents a failure in due diligence and objective reporting. The professional decision-making process for similar situations should involve a systematic, multifaceted approach. This includes 1. Thorough understanding of the case facts and the specific forensic question being asked. 2. Meticulous collection and examination of all available evidence, both questioned and known. 3. Application of validated forensic podiatry techniques and methodologies. 4. Objective interpretation of findings, acknowledging limitations and uncertainties. 5. Clear and accurate communication of conclusions, supported by scientific rationale, to the relevant legal authorities or parties. Adherence to professional standards and ethical guidelines is paramount throughout the process. Question 14. The assessment process reveals a patient presenting with symptoms consistent with moderate hallux valgus. The patient, having researched online, strongly insists on a specific surgical procedure they believe will provide the quickest cosmetic result, despite your clinical judgment indicating that a different, less invasive surgical technique is more appropriate for their current stage of deformity and carries a lower risk profile. How should you proceed? Option A. Inform the patient that their requested procedure is not medically indicated and refuse to perform it, recommending they seek a second opinion from another podiatric surgeon. Option B. Proceed with the surgical procedure the patient has requested, as patient autonomy is paramount, and their informed decision should be respected without further debate. Option C. Engage in a detailed discussion with the patient about the diagnosis, the recommended surgical approach, its expected outcomes, potential risks and benefits, and thoroughly explain why the alternative procedure they prefer, while potentially offering a different aesthetic outcome, may not be the most functionally sound or safest option for their specific condition, ultimately collaborating on a shared decision. Option D. Perform the recommended, less invasive surgery, and then explain to the patient post-operatively why this was the better choice for their long-term foot health. The correct answer is C. Engage in a detailed discussion with the patient about the diagnosis, the recommended surgical approach, its expected outcomes, potential risks and benefits, and thoroughly explain why the alternative procedure they prefer, while potentially offering a different aesthetic outcome, may not be the most functionally sound or safest option for their specific condition, ultimately collaborating on a shared decision. Explanation. The assessment process reveals a common ethical dilemma faced by podiatric physicians, balancing the patient's immediate desire for a specific treatment with the physician's professional obligation to provide evidence-based care and ensure patient safety. The challenge lies in navigating patient autonomy against the physician's duty of care, particularly when the patient's request may not align with the most appropriate or safest course of action, based on current medical understanding and established practice guidelines. This scenario requires careful judgment to ensure the patient is fully informed, understands the risks and benefits, and ultimately makes a decision that is in their best medical interest, while respecting their right to choose. The correct approach involves a thorough and empathetic discussion with the patient, clearly explaining the diagnosis, the rationale behind the recommended treatment plan, and the potential risks and benefits of all viable options, including the patient's preferred but potentially suboptimal intervention. This approach aligns with the ethical principles of informed consent and beneficence, as mandated by professional standards and regulatory frameworks governing medical practice in the United States. Specifically, the American Board of Podiatric Medicine, APPM certification examination, implicitly expects candidates to demonstrate adherence to these principles, which are foundational to patient care and professional conduct. The physician must ensure the patient understands why the recommended treatment is superior, addressing any misconceptions or fears the patient may have about the physician's preferred approach. An incorrect approach would be to immediately accede to the patient's request without a comprehensive discussion and exploration of alternatives. This failure to provide adequate information and guidance violates the principle of beneficence and can lead to suboptimal outcomes or patient harm, potentially exposing the physician to ethical and legal repercussions. Another incorrect approach involves dismissing the patient's concerns or preferences outright, which undermines patient autonomy and can damage the physician-patient relationship, leading to distrust and noncompliance. Finally, pressuring the patient into a specific treatment without fully addressing their concerns or understanding their motivations is also ethically unsound and fails to uphold the standards of professional medical practice. The professional decision-making process in such situations should involve 1. Active listening to understand the patient's perspective and concerns. 2. Conducting a thorough clinical assessment to confirm the diagnosis and identify all relevant factors. 3. Clearly communicating the diagnosis and the evidence-based treatment options, including their respective risks, benefits, and prognoses. 4. Addressing patient questions and concerns directly and empathetically. 5. Collaborating with the patient to develop a mutually agreeable treatment plan that prioritizes their well-being and respects their autonomy. 6. Documenting the entire process, including the informed consent discussion. Question 15. Governance review demonstrates a need to optimize the process for orthotic prescription and fabrication. A patient presents with chronic plantar heel pain, reporting significant discomfort with prolonged standing and walking. Objective gait analysis reveals excessive pronation and a reduced first ray plantar flexion during the stance phase. The podiatric physician is considering various orthotic interventions. Which of the following approaches best reflects a process optimized for effective patient outcomes and adherence to best practices in biomechanics and orthotics? Option A. Prescribe a custom orthotic designed to provide aggressive arch support and heel cushioning, based primarily on the patient's subjective report of pain and the presence of pronation. Option B. Conduct a comprehensive biomechanical assessment, integrating the patient's history, physical examination, and objective gait analysis findings to determine the specific biomechanical deficits contributing to the pain, and then select the most appropriate orthotic intervention, custom or prefabricated, to address these deficits. Option C. Recommend a standard, over-the-counter prefabricated orthotic with moderate arch support, as this is a common and cost-effective solution for heel pain. Option D. Fabricate a custom orthotic with a rigid posting to control pronation, without further detailed analysis of the gait cycle beyond the initial observation of pronation. The correct answer is A. Prescribe a custom orthotic designed to provide aggressive arch support and heel cushioning, based primarily on the patient's subjective report of pain and the presence of pronation. Explanation. Scenario analysis. This scenario presents a common clinical challenge where a podiatric physician must balance patient-reported symptoms with objective biomechanical findings to prescribe the most effective orthotic intervention. The challenge lies in interpreting subjective patient experience, objective gait analysis data, and the available evidence for different orthotic types, all while adhering to professional standards and patient-centered care principles. The physician must avoid over-reliance on one data point and instead synthesize information for optimal patient outcomes. Correct approach analysis. The correct approach involves a comprehensive biomechanical assessment that integrates subjective patient history, physical examination findings, and objective gait analysis data. This holistic evaluation allows the podiatric physician to identify the root biomechanical contributors to the patient's pain and functional limitations. Based on this thorough assessment, the physician can then select the most appropriate orthotic intervention, whether custom or prefabricated, that directly addresses the identified biomechanical issues. This approach aligns with the American Board of Podiatric Medicine's emphasis on evidence-based practice and the ethical obligation to provide individualized patient care, ensuring the prescribed orthotic is not only technically sound, but also clinically indicated and likely to yield positive results. Incorrect approaches analysis. Prescribing a custom orthotic solely based on the patient's subjective report of pain, without a thorough biomechanical assessment and objective gait analysis, is an incorrect approach. This fails to address the underlying biomechanical dysfunction and may lead to an ineffective or even detrimental orthotic. It deviates from evidence-based practice and potentially wastes patient resources. Recommending a prefabricated orthotic solely because it is readily available and less expensive, without considering if it adequately addresses the patient's specific biomechanical needs identified through assessment, is also an incorrect approach. This prioritizes convenience or cost over clinical efficacy and patient well-being, potentially leading to continued pain and dissatisfaction. Fabricating a custom orthotic based on a generic biomechanical model, without considering the specific findings from the patient's gait analysis and physical examination, is an incorrect approach. This demonstrates a lack of individualized patient care and may result in an orthotic that does not effectively correct the patient's unique biomechanical issues. Professional reasoning. Professionals should approach this situation by first prioritizing a thorough patient history and physical examination. This should be followed by objective biomechanical assessment, including gait analysis. The data gathered from these steps should then be synthesized to form a differential diagnosis of the biomechanical contributors to the patient's symptoms. Finally, the physician should select the orthotic intervention, custom or prefabricated, that is most likely to address these identified biomechanical issues, considering patient factors, evidence, and cost-effectiveness. This systematic, evidence-based approach ensures optimal patient care and adherence to professional standards. Question 16. Regulatory review indicates that a podiatric physician is treating a patient who has been experiencing increasing difficulty with self-care due to a chronic condition. The patient's adult daughter has been assisting with many aspects of her mother's care, including transportation to appointments and managing medications. During a follow-up appointment, the daughter asks the podiatrist for a detailed update on her mother's foot condition, including prognosis and treatment recommendations, stating that she needs this information to effectively manage her mother's care at home. The patient is present during this conversation, but appears somewhat disoriented and defers to her daughter when asked if she is comfortable sharing this information. What is the most appropriate course of action for the podiatrist? Option A. Assume that the patient has implicitly consented to the disclosure of her medical information to her daughter due to her apparent reliance on her for care and her presence during the discussion. Option B. Obtain a written authorization from the patient, specifically permitting the disclosure of her protected health information to her daughter for the purpose of care coordination. Option C. Politely decline to discuss the patient's medical information with the daughter, explaining that patient confidentiality prevents such disclosures without explicit consent, and advise the patient to communicate any information she wishes to share. Option D. Provide the daughter with a comprehensive update on the patient's condition, as she is clearly acting as the primary caregiver and needs the information to manage her mother's care. Correct answer is B. Obtain a written authorization from the patient, specifically permitting the disclosure of her protected health information to her daughter for the purpose of care coordination. Explanation. This scenario presents a common ethical and legal challenge in podiatric practice, balancing a patient's right to privacy with the need to communicate essential medical information to a third party, in this case, a family member who is acting as a caregiver. The professional challenge lies in navigating the nuances of patient confidentiality, particularly when the patient may have diminished capacity or is relying on others for care. Strict adherence to HIPAA regulations is paramount, as is the ethical obligation to respect patient autonomy and privacy. The correct approach involves obtaining explicit, informed consent from the patient for the disclosure of their medical information to their daughter. This aligns with the core principles of patient confidentiality enshrined in HIPAA, specifically 45 CFR Section 164. 508 outlines the requirements for authorizations for the use and disclosure of protected health information. The authorization must be in writing, clearly state the purpose of the disclosure, identify the recipient, and specify the information to be disclosed. If the patient's cognitive state is a concern, the podiatrist must assess their capacity to provide consent. If the patient lacks capacity, consent may need to be obtained from a legally authorized representative, but this should be done with the patient's best interests in mind, and if possible, with their assent. An incorrect approach would be to disclose the information based solely on the daughter's assertion that she is the caregiver. This violates HIPAA privacy rules, as it constitutes a disclosure of PHI without proper authorization. The daughter's role as a caregiver does not automatically grant her access to the patient's medical records. Another incorrect approach would be to refuse to communicate any information to the daughter, even if the patient has consented, thereby hindering effective care coordination. While patient confidentiality is critical, it should not impede necessary communication when authorized by the patient. Finally, assuming the patient has implicitly consented due to their reliance on the daughter for care is a dangerous assumption and a violation of explicit consent requirements under HIPAA. The professional reasoning process for such situations should begin with a clear understanding of the patient's wishes and their capacity to communicate them. If there is any doubt about capacity, a formal assessment should be considered. Next, the podiatrist must consult the relevant regulations, primarily HIPAA, to understand the requirements for disclosure. Obtaining written, informed consent is the gold standard. If the patient is unable to provide consent, the podiatrist must identify and verify the legally authorized representative and follow the appropriate procedures for obtaining consent from that individual, always prioritizing the patient's well-being. Open communication with both the patient and their designated caregiver within the bounds of confidentiality is essential for effective patient care. Question 17. Compliance review shows a podiatric physician is evaluating a patient presenting with chronic plantar heel pain, burning paresthesias in the medial arch, and weakness in toe flexion. The physician suspects a nerve entrapment syndrome. Which of the following diagnostic strategies best aligns with the principles of accurate diagnosis and patient management within the American Board of Podiatric Medicine's framework? Option A. Prescribe a course of oral anti-inflammatory medications and recommend rest, then reevaluate in 6 weeks. Option B. Advise the patient that these symptoms are likely due to generalized peripheral neuropathy and recommend supportive footwear. Option C. Immediately refer the patient for surgical decompression of the tibial nerve. Option D. Perform a comprehensive neurological examination, including sensory and motor testing, and order nerve conduction velocity, NCV, and electromyography (EMG) studies. The correct answer is A. Prescribe a course of oral anti-inflammatory medications and recommend rest, then reevaluate in 6 weeks. Explanation. Scenario analysis. This scenario presents a common clinical challenge in podiatric medicine, differentiating between various nerve entrapment syndromes and peripheral neuropathies affecting the foot and ankle. The professional challenge lies in accurately diagnosing the underlying cause of the patient's symptoms, which can manifest with overlapping clinical presentations. Misdiagnosis can lead to inappropriate treatment, delayed recovery, and patient dissatisfaction, potentially impacting the podiatrist's adherence to standards of care and professional responsibilities. The need for careful judgment is paramount in selecting diagnostic modalities that are both effective and aligned with current best practices and regulatory expectations for patient care. Correct approach analysis. The correct approach involves a comprehensive evaluation that integrates detailed patient history, thorough physical examination, and judicious use of electrodiagnostic studies. This systematic methodology is crucial for accurately identifying the specific nerve entrapment or neuropathy. Electrophysiological studies, such as nerve conduction velocity (NCV) and electromyography (EMG), are specifically indicated for evaluating nerve function and identifying the location and severity of nerve compromise. This approach aligns with the American Board of Podiatric Medicine's emphasis on evidence-based practice and the application of diagnostic tools to confirm or refute suspected neurological conditions. The regulatory framework for medical practice, including that overseen by the APA, mandates that practitioners utilize appropriate diagnostic methods to ensure accurate diagnosis and effective treatment planning, thereby upholding the standard of care. Incorrect approaches analysis. One incorrect approach is to rely solely on subjective patient reports and a limited physical examination without employing objective diagnostic tools. This fails to meet the standard of care by not adequately investigating the underlying pathophysiology of the neurological symptoms. Risks misdiagnosis, leading to ineffective or even harmful treatments, and potentially violates ethical obligations to provide thorough and competent care. Another incorrect approach is to immediately proceed with invasive surgical intervention based on a presumptive diagnosis without objective confirmation. This bypasses crucial diagnostic steps, including electrophysiological testing, which are essential for confirming the diagnosis, determining the extent of nerve damage, and guiding treatment decisions. Such an approach can be considered premature and potentially negligent, as it does not adhere to the principle of using the least invasive effective diagnostic and therapeutic methods. A third incorrect approach is to attribute all foot and ankle neurological symptoms to diabetic neuropathy without considering other potential causes, especially in a patient without a known history of diabetes or with atypical symptoms. While diabetic neuropathy is a common cause of peripheral neuropathy, other nerve entrapment syndromes can mimic its presentation. This oversimplification can lead to misdiagnoses of treatable conditions and delay appropriate management for the actual underlying issue. Professional reasoning. Professionals should approach such cases by first gathering a detailed history, including symptom onset, character, duration, aggravating and alleviating factors, and any relevant medical history, e.g., diabetes, trauma, repetitive activities. This is followed by a comprehensive physical examination, including sensory testing, motor strength assessment, and palpation for tenderness or masses. Based on these findings, a differential diagnosis is formulated. Electrophysiological studies are then considered as a crucial adjunct to confirm suspected nerve entrapment or neuropathy, localize the lesion, and assess its severity. This structured, evidence-based approach ensures that diagnostic and therapeutic decisions are informed, patient-centered, and compliant with professional standards. Question 18. Process analysis reveals that a podiatric physician encounters a peer-reviewed research study published in a reputable journal that presents novel findings, suggesting a significant improvement in outcomes for a common condition treated in their practice. But these findings challenge established treatment protocols that the physician has successfully utilized for years. What is the most appropriate initial step for the physician to take in integrating this new evidence into their practice? Option A. Disregard the study's findings, as they contradict long-standing and personally successful clinical protocols. Option B. Immediately adopt the new treatment protocol described in the study, assuming that published research in a reputable journal is always accurate and applicable. Option C. Discuss the study's findings with colleagues and base the decision to adopt the new protocol primarily on their collective opinions and experiences. Option D. Critically appraise the research study's methodology, statistical validity, and clinical relevance to their patient population before considering any changes to established protocols. The correct answer is D. Critically appraise the research study's methodology, statistical validity, and clinical relevance to their patient population before considering any changes to established protocols. Explanation. Scenario analysis. This scenario presents a common challenge in evidence-based practice. A podiatric physician must integrate new research findings into their clinical decision-making while adhering to established professional standards and regulatory expectations. The challenge lies in discerning the validity and applicability of research, especially when it contradicts or modifies existing clinical protocols. The American Board of Podiatric Medicine (ABPM) certification emphasizes a commitment to lifelong learning and the application of current, evidence-based knowledge. Failure to critically appraise research or to appropriately integrate it can lead to suboptimal patient care and potential professional repercussions. Correct approach analysis. The correct approach involves a systematic and critical evaluation of the research study. This includes assessing the study's methodology, e.g., study design, sample size, statistical analysis, the strength of the evidence presented, and its direct relevance to the podiatric physician's patient population and clinical practice. The ABPM certification framework implicitly requires practitioners to stay abreast of advancements and to critically evaluate new information before adopting it into practice. This aligns with the core principles of evidence-based medicine, which mandate that clinical decisions be based on the best available evidence, clinical expertise, and patient values. The regulatory framework for medical practice, as overseen by bodies like the ABPM, expects practitioners to demonstrate competence in research appraisal and its application. Incorrect approach is analysis. One incorrect approach is to immediately dismiss the new research because it contradicts established protocols or personal experience. This demonstrates a lack of commitment to continuous learning and critical appraisal, which is contrary to the principles of evidence-based practice and the expectations of professional certification. It suggests an adherence to dogma rather than an objective evaluation of evidence. Another incorrect approach is to uncritically accept the new research findings and immediately alter clinical protocols without thorough appraisal. This can be dangerous, as it may lead to the adoption of flawed or inapplicable research, potentially compromising patient safety and care. It bypasses the essential step of critical evaluation required by evidence-based practice. A third incorrect approach is to rely solely on anecdotal evidence or the opinions of colleagues without consulting the primary research. While collegial discussion is valuable, it should supplement, not replace, the direct appraisal of scientific literature. This approach fails to meet the rigorous standards of evidence-based practice expected by professional boards. Professional reasoning. Professionals facing this situation should employ a structured approach to evidence appraisal. This involves 1. Identifying the clinical question. 2. Searching for relevant, high-quality research. 3. Critically appraising the identified studies for validity, reliability, and applicability. 4. Integrating the research findings with clinical expertise and patient preferences. 5. Evaluating the outcomes of the change in practice. This systematic process ensures that clinical decisions are informed by the best available evidence, aligning with professional ethical obligations and regulatory requirements for competent practice. Question 19. Strategic planning requires a podiatric physician to determine the most appropriate initial management for a complex, non-healing lower extremity wound in a patient with multiple comorbidities. Considering the principles of wound healing and the need for evidence-based practice, which of the following represents the most judicious initial approach? Option A. Apply a broad-spectrum topical antimicrobial ointment and cover the wound with a sterile, dry gauze dressing to prevent further contamination. Option B. Perform a thorough wound assessment including measurement, depth, presence of undermining or tunneling, exudate characteristics, and tissue type, followed by selection of an appropriate debridement method based on the wound bed findings and application of a dressing designed to maintain a moist wound healing environment. Option C. Immediately refer the patient for hyperbaric oxygen therapy without a detailed wound assessment, assuming it will accelerate healing. Option D. Cleanse the wound superficially with saline and apply a simple adhesive bandage, as the patient has a history of poor compliance with complex regimens. Correct answer is B. Perform a thorough wound assessment including measurement, depth, presence of undermining or tunneling, exudate characteristics, and tissue type, followed by selection of an appropriate debridement method based on the wound bed findings and application of a dressing designed to maintain a moist wound healing environment. Explanation: this scenario is professionally challenging because it requires the podiatric physician to balance immediate patient needs with long-term, evidence-based wound management strategies, all while adhering to the specific standards of care expected within the American Board of Podiatric Medicine Certification Examinations regulatory framework. The physician must consider not only the current state of the wound, but also the patient's overall health, potential for healing, and the most effective, cost-efficient, and compliant treatment modalities. Careful judgment is required to select the most appropriate debridement technique and dressing, ensuring patient safety and optimal outcomes within the established guidelines. The correct approach involves a comprehensive wound assessment to accurately classify the wound and identify underlying etiologies, followed by the selection of a debridement technique that is appropriate for the wound type and the patient's condition. And finally, the application of a dressing that promotes a moist wound healing environment and protects the wound bed. This aligns with the principles of evidence-based practice and the ethical obligation to provide competent care as expected by the American Board of Podiatric Medicine. Regulatory guidelines emphasize thorough documentation, patient education, and the use of validated assessment tools, all of which are integral to this approach. An incorrect approach that focuses solely on superficial cleaning, without addressing devitalized tissue, fails to meet the fundamental requirements of wound bed preparation, potentially hindering healing and increasing infection risk. This neglects the regulatory expectation for effective debridement as a cornerstone of wound management. Another incorrect approach that involves applying a standard dressing without considering the exudate level, depth, or presence of infection overlooks the critical principle of tailoring treatment to the specific wound characteristics, which is a core competency assessed by the board. This demonstrates a failure to apply knowledge of wound physiology and dressing science, leading to suboptimal outcomes and potential complications. A third incorrect approach that relies on anecdotal evidence or unproven therapies without scientific validation or regulatory approval would violate the principles of evidence-based medicine and could expose the patient to harm, contravening the ethical and regulatory standards of the profession. Professionals should employ a systematic decision-making process that begins with a thorough patient history and physical examination, including a detailed wound assessment. This assessment should guide the selection of appropriate diagnostic tests, debridement methods, and dressing materials. Continuous reassessment of the wound's progress and the patient's response to treatment is crucial for adjusting the care plan as needed. Adherence to established clinical practice guidelines and regulatory requirements ensures that patient care is both effective and compliant. Question 20. Research into the management of congenital foot deformities in pediatric patients has identified several potential diagnoses based on initial presentation. A 6-month-old infant presents with a foot that appears to be turned inward, with the forefoot adducted and the heel in a varus position. The arch appears high, and the foot is rigid. The parents report noticing this since birth. Which of the following diagnostic and management approaches best reflects current best practices for this presentation within the U.S. regulatory framework? Option A. Perform a thorough physical examination, including assessment of passive range of motion, and obtain weight-bearing X-rays of the foot and ankle to confirm the diagnosis and guide treatment planning, followed by a discussion of conservative management options such as serial casting and physical therapy with the parents. Option B. Reassure the parents that the condition will likely resolve spontaneously with growth and recommend observation without further intervention. Option C. Immediately schedule the infant for surgical correction of the deformity, as early intervention is crucial for optimal outcomes in congenital foot conditions. Option D. Prescribe custom orthotics to correct the foot's alignment, as this is a common and effective treatment for pediatric foot deformities. Correct answer is A. Perform a thorough physical examination, including assessment of passive range of motion, and obtain weight-bearing X-rays of the foot and ankle to confirm the diagnosis and guide treatment planning, followed by a discussion of conservative management options such as serial casting and physical therapy with the parents. Explanation: this scenario presents a common yet complex challenge in pediatric podiatry, requiring a nuanced approach to diagnosis and management of a congenital foot deformity. The professional challenge lies in accurately differentiating between similar appearing conditions, understanding the long-term implications of each, and developing a treatment plan that aligns with current best practices and patient-centered care, all within the regulatory framework governing medical practice in the United States. The correct approach involves a comprehensive clinical evaluation, including a detailed history, thorough physical examination, and appropriate imaging, followed by a discussion of evidence-based treatment options with the parents. This aligns with the American Board of Podiatric Medicine's commitment to upholding high standards of patient care, emphasizing accurate diagnosis and informed consent. Regulatory frameworks in the U.S. mandate that practitioners provide care consistent with the accepted standards of practice, which includes utilizing diagnostic tools and patient education to facilitate shared decision-making. Ethical guidelines also underscore the importance of acting in the best interest of the patient and respecting the autonomy of the parents in making healthcare decisions for their child. An incorrect approach would be to prematurely diagnose or recommend a treatment based on limited information or anecdotal evidence. For instance, immediately recommending aggressive surgical intervention without a thorough workup or exploring conservative options first would be a failure to adhere to the standard of care. This could lead to unnecessary procedures, potential complications, and a breach of the practitioner's duty to provide appropriate and evidence-based care. Another incorrect approach would be to dismiss parental concerns or fail to adequately explain the diagnostic process and treatment rationale. This violates the principles of informed consent and patient-provider communication, which are fundamental to ethical medical practice and are implicitly supported by regulatory oversight that ensures patient rights are protected. Professionals should employ a systematic decision-making framework that begins with gathering comprehensive patient data, followed by differential diagnosis, consideration of evidence-based treatment modalities, and collaborative decision-making with the patient's guardians. This framework ensures that all relevant factors are considered, leading to the most appropriate and ethically sound management plan.